Today I'll be discussing type 1 diabetes' effect on exercise. Diabetes is a disease that the body's ability to produce or respond to the hormone insulin is impaired, so it's resulting in an abnormal metabolism of the carbohydrates and elevating the levels of blood glucose in the blood and also in the urine. There are two types of diabetes, type 2, which is more common, and type 1. Type 2 occur in overweight and unhealthy people, and correction of their lifestyle, such as a diet and exercise, can lower the insulin problem. And type 1 diabetes occurs in thin and usually children, and it is because type 1 diabetes is insulin-dependent diabetes, which is a chronic condition in which the pancreas cannot produce enough. It only produces little or no insulin, which is the hormone that is needed to allow glucose to enter to produce energy. Type 1 diabetes is shown in this picture that it's an immune cells destroy the beta cells in the pancreas, so it means that the pancreas can't produce insulin, and if you don't have insulin, then you can't make glucose. The glucose and insulin can't move towards the cell to produce normal cells, so that's the reason they need to get injections for insulin. And in a normal healthy cell, the insulin and the glucose move towards the cell. Diabetes is very common, and it occurs in 29 million people in the United States, and also 86 million people in the United States are pre-diabetes, which means that they have high blood sugar levels, but it's not high enough to be categorized as diabetes. And also the prediction is that it's going to increase the more amount of diabetes because of how unhealthy our lifestyles are. But for type 1 diabetes, it's a little less common. It's only 1.25 million of people, and 200,000 youth have it. These are symptoms that a child will be experiencing with type 1 diabetes, so they need to see a doctor immediately so that they can get on insulin shots to help the pancreas. For exercising with diabetes, it's important to remember frequency, so you can do it very often, but your intensity cannot be max intensity. It has to stay in the 60 to 80 range, and the time frame is very important because you don't want hypoglycemia, which means that their blood sugar gets too low. Lifestyles. It's important to exercise because it reduces the cardiovascular disease risk, but there's also the chance of your blood glucose getting too low and occurring, and hypoglycemia occurring. There's two types of exercise. Aerobic exercise, which is walking, cycling, jogging, and swimming. It's just repetitive and continuous motion. It does require energy, but once the athlete practices or walks or jogs for about 45 minutes, they might have a chance of hypoglycemia occurring, so that they might need an insulin shot or need some carbohydrates to increase their blood sugar. Anaerobic exercise is sprinting, weightlifting, and some competitive sports. It's a resistive exercise, so it has stability in the glucose, and this requires an increase in insulin, so they need to eat carbohydrates before and after practice and also get injections. There are important foods that they need to eat, and if they're practicing for 30 to 60 minutes, they need to make sure that they're replacing their fluids and that they're well hydrated before, and make sure that the replacement of the fluids is because of the loss that they've had during sweating. And if they practice for about an hour to 3 hours, it's important to replace fluids and also carbohydrates. And if they're practicing for longer than 3 hours, they need to replace their fluids, of course, because of the loss of sweating, and they need to eat carbohydrates, and also sodium needs to be intaken because of the chance of hypoglycemia. Monitoring and managing diabetes depends on the athlete. It depends on how severe the case is and what type of effects of exercise that they're doing. If they're just an athlete that runs, it's different than a baseball player, and each exercise program needs to be specific to a person, and they need to make sure that they're giving themselves the correct insulin amounts, and they're eating the correct diet, and that they're exercising normally, and also monitoring their blood glucose so they do not have hypoglycemia, which means that their blood glucose gets too low, or hyperglycemia, which means that their blood glucose increases too high. And that is the end of my